Hello and welcome to this session. Today we are looking at different types of anemia, and we start by defining what anemia is. Anemia is a condition that is characterized by the decrease in number of red blood cells, the erythrocytes, in the amount of hemoglobin in blood, and this normally leads to reduced oxygen carrying capacity. So tissues are deprived of oxygen. And we have a number of causes. We have excessive bleeding. We have leaky GIT, low acid, stomach acid, iron deficiency, vitamin B12 deficiency, folate deficiency. We have poor diets. Okay, we have chronic diseases. We have intestinal disorders, infections, chronic diseases, liver diseases, thyroid diseases, pregnancy, enzyme deficiencies, and autoimmunity. Okay, so starting with the first cause, we're saying that excessive bleeding. Yeah. So how does excessive bleeding cause anemia? Saying that any form of significant bleeding, whether could be due to injury, surgery, or intestinal bleeding, can rapidly decrease the volume of circulating blood, leading to acute anemia. Whereas the GUT bleeding in the gastrointestinal tract, could be the stomach or the intestines, could lead to significant loss of blood, causing anemia. So the most common causes of this GAT bleeding could be the ulcers or gastritis or colorectal polyps or any types of cancer. Also, low acid secretion has also been a cause of anemia, whereby we know that acid is essential for iron absorption. So low acid levels can also impair iron absorption, leading to iron deficiency anemia, which is the most common type of anemia. So this iron deficiency, we are saying that iron is a very vital component of the hemoglobin. So insufficient amount of iron supply, often due to poor diet, blood loss, or malabsorption, normally result in decreased hemoglobin production, causing iron deficiency anemia. Okay. So for the poor diet, you're saying that inadequate intake of nutrients is normally essential for the red blood cell production. So such as you could have iron, vitamin B12, and folate. This could lead to nutritional deficiencies that normally cause anemia. Equally for vitamin B12 deficiency, yeah, the megaloblastic anemias. Vitamin B12, the cobalamin, is crucial for DNA synthesis and maturation of red blood cells. So deficiency of this often due to poor diet, malabsorption issues, normal results in large, fragile red blood cells that will result in macrocytic anemia. Folate deficiency, and this is folic acid. It's essential for red blood cell production. So inadequate intake or malabsorption can lead to folate deficiency anemia, characterized by large red blood cells, also microcytic anemia. It's good to note that folate deficiency and vitamin B12 deficiency, remember this is vitamin 9, okay, 9, all of them lead to macrocytic anemia. We also have the chronic diseases, where we're saying that chronic inflammatory conditions such as autoimmune disorders and certain cancers can also interfere with the body's ability to produce red blood cells, leading to anemia and chronic diseases. So kidney causes could also cause anemia or lead to anemia. So we know that kidney normally produces erythropoietin. This hormone stimulates the bone marrow to produce red blood cells. So you find that in a kidney disease, especially in chronic kidney disease, this can lead to decreased erythropoietin production, resulting into anemia. For the liver diseases, we know that the liver normally plays an important role in iron metabolism and storage. So in cases where someone has a liver disease like cirrhosis, this can impair these functions, and this leads to anemia, particularly due to decreased production of proteins that are normally necessary for iron transport. As for the thyroid causes, we know that the thyroid hormones normally influence metabolism, yeah, the T3 and the T4, and this includes red blood cell production. So in a case where we have thyroid disorders, particularly hypothyroidism, that is underactive thyroid, this can lead to anemia that is due to decreased erythropoiesis, and that is the formation of red blood cells. So also it's saying now that infections could also lead to anemia, where chronic infections could cause anemia by various mechanisms, including inflammation, direct destruction of red blood cells, or interference with the production of erythropoietin. As for the pregnancy, you know that during pregnancy the body's blood volume normally expands, and this leads to a relatively decrease in concentration of red blood cells. This normally causes a type of anemia that is referred as physiological anemia of pregnancy. Additionally, iron deficiency is common in pregnant women, and this is majorly because of the malaria parasites. Okay, correct. Enzyme deficiency. So deficiencies such as the glucose 6 phosphate dehydrogenase, the G6PD deficiency, can lead to hemolysis of the red blood cells. And when you have hemolysis of the red blood cells, result in anemia. Autoimmunity is also another disorder where you find that autoimmune disorders such as hemolytic anemia occur when the immune system mistakenly attacks and destroys the red blood cells, causing anemia. Intestinal disorders like the celiac disease or inflammatory bowel disease can impair nutrient absorption, leading to deficiencies in iron, the vitamin B12, or folate, both causing the different types of anemia. So in anemia, we normally carry out some of the hematological tests. Okay, so you could have, like, you are interested with the mean corpuscular volume, whereby the normal range for the MCV is usually 80 to 100, 80 to 100 femtoliters. Okay, so in the case where someone has as the values are outside this range, then we can be able to categorize different types of anemia. So it could be microcytic, it could be macrocytic, or normocytic type of anemia. So in this case, for our patient here, this one is normocytic because it's within the range, which is 80 to 100. So the mean corpuscular volume is a measure of the average volume or the size of a single red blood cell. So the MCV is typically reported in femtoliters, abbreviated as FL, which is normally equivalent to the 10 raised to 15 liters. And we could have normal, macrocytic, where they are small, and macro, they are big. Okay, they are big. So macrocytic, and normocytic are these terms used to describe the size of the red blood cells that we have already talked about. So the first one, we have the microcytic anemia. So the microcytic anemia, you find that is characterized by small blood vessels, and these smaller cells typically have decreased mean corpuscular volume, which is normally less than 80. Okay, less than 80. Okay, less than 80. So the causes of so this less than 80, that's what will give you these types of microcytic anemia. So the causes could be maybe iron deficiency anemia, whereby this is the most common cause of microcytic anemia, and is the most common type of anemia. So iron is very essential for the production of the hemoglobin, and lack of iron normally leads to this smaller paler RBCs. Okay, thalassemia is also another condition that could lead to microcytic anemia. So a group of inherited blood disorders that normally affect hemoglobin production, leading to microcytic anemia. And lastly, we have chronic diseases where certain chronic inflammatory conditions can result into microcytic anemia. Guys, for you to remember the different types of anemia that are microcytic in nature, we use the term the mnemonic tick, where this one is thalassemia, we have the iron-deficiency anemia, and lastly we have chronic disease anemia. Okay, so next we have the macrocytic anemia, macro with A, and macrocytic is characterized by abnormally large red blood cells. So these larger cells typically have an increased mean corpuscular volume that is above 100, which is higher than the normal range. So common causes could include vitamin B12 deficiency. So there is lack of vitamin B12, which is normally essential for DNA synthesis and maturation of RBCs, which could result in macrocytic anemia, followed by folate deficiency. And folate, this is vitamin B9, and is very essential for RBC production. So deficiency to this could also lead to macrocytic anemia. We also have certain drugs, such medication, particularly those that interfere with DNA synthesis, could also cause microcytic anemia. So, guys, to remember the mnemonic for the microcytic anemia, remember vitamin B, vitamin B12, vitamin B9. Okay, correct, guys. From there, we go to normocytic anemia, and normocytic anemia is characterized by normal size of red blood cells. So the mean corpuscular falls within the normal range, which is 80 to 100 femtoliters. So causes could be chronic diseases like the chronic kidney disease, inflammatory disorders. Certain types of cancer could lead to normocytic anemia. We also have the hemolysis, where conditions where red blood cells are destroyed faster than they are produced could also result in normocytic type of anemia. And lastly, we have bone marrow disorders. That these are disorders that normally affect the bone marrow, such as the myelodysplastic syndrome, which could lead to normocytic anemia. So we have a summary of microcytic normochromic anemia, microcytic hypochromic anemia, and lastly normocytic normochromic anemia, where in macrocytic we have the vitamin B12 deficiency and the folate deficiency. Whereas in micro, we have the tick, we have the thalassemia, we have the iron deficiency, and we have chronic diseases, although chronic diseases are rare. And lastly, normocytic, we have anemia due to chronic diseases, anemia of acute hemorrhage, and aplastic anemias and hemolytic anemias. Okay. So the general signs and symptoms of anemia include, first of all, fatigue and weakness. We know that there's normally reduced oxygen carrying capacity. That means less oxygen will reach the body tissues. So this includes the muscles. So as a result, muscles receive insufficient oxygen, leading to fatigue and weakness. Also on pale and jaundiced skin, anemia, especially due to hemolysis, that is the destruction of red blood cells, can cause paleness in the skin. So jaundice occur when the bilirubin, that's a breakdown product of RBCs, builds up and gives the skin a yellow, skin on the eyes a yellowish color. Shortness of breath, where we're talking of insufficient oxygen supply to the lungs and other tissues, leads to the shortness of breath, especially during physical activity when the body's oxygen demand increases. Okay? Next, we have the dizziness and lightheadedness. So, inadequate oxygen reaching the brain can cause dizziness and lightheadedness. So, reduced oxygen levels affect the brain's normal functioning, leading to such symptoms. What about the headaches and cold hands and feet? Anemia can affect blood flow and circulation, so improper circulation can lead to headaches. So cold hands and feet occur due to vasoconstriction. This is narrowing of the blood vessels as the body tries to conserve heat. We also have irregular heartbeat or arrhythmias. So the heart beats faster or irregularly to compensate for the reduced oxygen carrying capacity of the blood. So anemia puts stress on the cardiovascular system, leading to arrhythmias. Cognitive impairment. So we have inadequate oxygen supply to the brain affects cognitive functions, leading to difficulties in concentrations, memory problems, and confusion. Brittle nails and pale nail beds. So poor oxygen supply affects the nail health, leading to brittle nails. So paleness of the nail beds is normally due to blood flow in the blood vessels under the nails. We also have another syndrome, we call it the restless leg syndrome, whereby, especially in iron deficiency anemia, and it's linked to a restless leg syndrome, possibly due to altered dopamine levels in the brain. We have also cold and numb hands and feet. Impaired circulation normally leads to poor blood flow to the extremities, causing them to be cold or numb. Okay? So the first type of anemia is the iron deficiency anemia, and this type is the most common type of anemia. It occurs when the body lacks sufficient iron to produce adequate amount of hemoglobin. Iron deficiency can be caused by inadequate dietary intake, poor absorption of diet, or blood loss due to menstrual or injury. Okay, so menstrues, more recent surgery, lack of iron in the diet, blood loss from the nosebleeds, experiencing physical trauma, and so on and so forth. So you find that the iron deficiency anemia, the body will lack sufficient iron to produce enough healthy RBCs. So in a normal HB normally consists of the hemoglobin consists of four protein chains. These are the globin chains, and each is bound to a heme group. So each heme group contains an ion, that is an ion at its core. So it is this ion that normally binds to oxygen molecules, allowing hemoglobin to carry oxygen. So if not there, then the hemoglobin will not be formed and oxygen will not be transported to different parts of the body. Vitamin deficiency anemias. This one we normally call them the megaloblastic anemia. So we have vitamin B12 deficiency, also referred to as pernicious anemia, and folate deficiency anemia. So pernicious anemia results from deficiency in vitamin B12, which is essential for the production of the red blood cells. It can be caused by poor diet intake or malabsorption issues or certain medical condition. You find that vitamin B12 is necessary for the DNA synthesis and it's a fundamental process in the division, including formation of RBCs. So without B12, the DNA in the developing RBC cannot replicate properly. So vitamin B12 is involved in the maturation of RBCs in the bone. It helps in the development of RBCs nucleus and other cellular components. Vitamin B12 deficiency can lead to the progression of large immature RBCs, the one that we are referring as megaloblastic anemias. Okay, vitamin B12 and vitamin B9. All right. Okay, so for the folate deficiency, we're saying that it's another B vitamin essential for red blood cell production. Folate deficiency can result from insufficient diet intake, malabsorption, and increased demand during pregnancy. So folate is very crucial for the DNA synthesis and cell division, including the division of the precursor cells that give rise to RBCs. So folate is involved in the production of the purines and the pyrimidines, which are the building blocks of the DNA. Folate is essential for the normal maturation of the RBCs in the bone marrow. It supports the proper development of RBCs nucleus and other cellular structures. Folate deficiency can lead to a production of large immature RBCs causing megaloblastic anemia, and this is similar to vitamin B12 deficiency. There is a connection between vitamin B12 and vitamin B9 in that vitamin B12 is required to activate B9 to its active form, which is essential for DNA synthesis. So without B12, folate cannot be properly in DNA, cannot function properly, leading to abnormalities with RBC formation. Hemolytic anemia. This type of anemias are when red blood cells are destroyed faster than the body can replace them. And it's caused because of a number of factors. We have intrinsic defects in the RBCs where genetic mutation, inherited genetic mutation can lead to structural abnormalities in the RBCs, making them prone to premature destruction, and includes sickle cell anemia and hereditary spherocytosis. Also, enzyme deficiencies and deficiencies in enzymes are crucial in red blood cell production, such as the glucose 6 phosphate dehydrogenase deficiency. It can lead to hemolysis, especially under certain conditions like exposure to specific foods or drugs. Also, extrinsic factors could lead to hemolytic anemia, like immune-mediated hemolysis. Antibodies produced by the immune system can mistakenly target and destroy red blood cells, leading to autoimmune hemolytic anemia. And this can be caused by autoimmune disorders such as certain foods or idiopathic of unknown causes. Infections, particularly malaria, can cause hemolysis. The malaria parasites normally infects red blood cells, causing them to be distracted or destroyed in the body. Toxins, where exposure to certain toxins, chemicals, and medication can damage red blood cells, causing them to rupture prematurely. And lastly, mechanical trauma to the red blood cells can also occur in conditions like microangiopathic hemolytic anemia, where RBCs are fragmented as they pass through the damaged blood vessels. We also have this a large spleen, where we're saying that the spleen is responsible for filtering blood and removing damaged or abnormal red blood cells from circulation. So in hemolytic anemia, the spleen becomes overreactive and may remove even normal blood cells prematurely due to increased workload. Or hemolysis in the spleen, where is saying that red blood cells passing through the spleen's congested sinus are subjected to mechanical stress and may be destroyed, especially if they are fragile or abnormal. We could also have compensatory mechanism, where we have bone marrow hyperactivity. In response to the reduced number of circulating RBCs, the bone marrow attempts to compensate by increasing production of new RBCs. However, this compensatory mechanism may not be sufficient to match the rate of destruction, leading to anemia. So, this patient, you find that they will present with anemic symptoms, where there is the decrease in the number of functional RBCs lead to symptoms such as fatigue, weakness, pallor, shortness of breath, and increased heart rate. We could also be having bilirubin accumulation. We know hemolysis causes hemoglobin from the ruptured red blood cells. So hemoglobin breakdown products, particularly bilirubin, can accumulate, leading to jaundice, and that is the yellowing of the skin and eyes, and dark urine. Aplastic anemia. So this is a rare type of anemia, but serious condition that occurs when the bone marrow fails to produce blood cells, including red blood cells. It could be acquired, that is due to exposure to the toxins, radiation, or certain medication, or it could be inherited. So, for example, and in all these cases, we normally lead to hematopoietic stem damage, okay, stem cell damage. And one, we have autoimmune diseases, where you find that anemia is believed to be due to autoimmune response, where the immune system mistakenly targets and destroys the hematopoietic stem cells in the bone marrow. Or exposure to certain toxins, chemicals, drugs, and radiation can damage bone marrow cells, leading to their dysfunction. Also, infectious agents, viruses like Epstein-Barr viruses or cytomegalovirus can sometimes trigger aplastic anemia by directly infecting and damaging the bone cells. Sickle cell anemia is also another genetic disorder where red blood cells have an abnormal crescent shaped. Okay, so these irregularly shaped cells can be stuck or can get stuck in blood vessels, leading to pain and organ damage. It is normally inherited from both parents who carry the single trait. Okay, and this is caused by genetic mutation, where the hemoglobin S mutation, single cell anemia, is caused by a specific mutation in the HBB gene, leading to production of abnormal hemoglobin known as hemoglobin S. The mutation causes red blood cells to become rigid, sticky, shaped like sickles, and which are normally crescent or C-shaped. So the sickling process normally leads to deoxygenation, where under conditions of low oxygen, such as during physical activity or stress, hemoglobin S molecules tend to clump together and polymerase within red blood cell. And this normally results into sickling of the red blood cell, where the polymerized hemoglobin distorts the shape of the red blood cells, causing them to assume a sickle shape. These sickled cells are less flexible and more prone to clumping and getting together in the blood vessel. So we have five types of crisis. We have vaso-occlusive crisis, hemolytic crisis, aplastic crisis, splenic sequestration crisis, and acute chest syndrome. So on vaso-occlusive syndrome, we have the blockage of small blood vessels by the so-called red blood cells, leading to damaged and severe pain. And it's normally characterized by intense pain, swelling, limited range of motion, and the trigger could be low oxygen, dehydration, stress, cold, or infection. So you always treat by relieving the pain, hydrating the patient, and putting the patient on oxygen therapy and addressing any triggers. As for the hemolytic crisis, this one is characterized by accelerated destruction of RBCs, causing a sudden drop in hemoglobin levels. And the patient could present with severe anemia, fatigue, weakness, jaundice, and dark urine. So the triggers could be infections, oxidative stress, certain medication, or toxins. So you always manage by subjecting the patient to transfusions and managing the triggers and giving supportive care where necessary. Aplastic crisis is characterized by sudden decrease in RBC cell production due to an infection often caused by the parvovirus. Okay, um, and this one, the symptoms, you have the profound anemia, fatigue, or weaknesses. And here we have the triggers. Could they be the parvovirus infection or other variants? Okay. Remember, this one being a viral, we are going to provide supportive care and blood transfusion if severe. Splenic sequestration crisis, where a large amount of blood pools in the spleen, causing a rapid drop in hemoglobins. So we normally have enlarged spleen, abdominal pain, weakness, and paleness. So often seen in children with the sickle cell, and you find that in management you could have immediate medical intervention, blood transfusion, and possible splenectomy. Lastly, we have acute chest syndrome that is characterized by inflammation and blockage of blood vessels in the lungs, leading to chest pain and breathing difficulties. So the patient will present with chest pain, shortness of breath, cough, and fever. The triggers could be infections, vaso-occlusive crisis, or pneumonia. So, in terms of management, you can hospitalize them, put them on oxygen therapy, administer antibiotics, and pain management. So, the thalassemias are our last conditions, and this one they are the cause anemia. And what type of anemia does it cause? Yes, microcytic anemia. Okay, remember tick. Okay, thalassemia, iron deficiency, and chronic diseases. So, thalassemias cause anemia by affecting the production of hemoglobin. This is the protein in the red blood cell responsible for carrying oxygen throughout the body. So hemoglobin is normally made up of two types of proteins or protein chains. You have the alpha and beta. Thalassemia from mutations in the genes control the production of these chains, leading to abnormal or insufficient hemoglobin production. So when you have reduced hemoglobin production, number one, we have alpha thalassemias, whereby there are mutations in the gene that code for alpha globin chains. So depending on the number of affected genes, individuals can have alpha thalassemia trait, that's mild, or alpha thalassemia major, that is severe. So severe or absent alpha globin chain production leads to insufficient hemoglobin formation, causing anemia. Equally, for the beta thalassemia, mutations in the genes that code for beta globin chain result in reduced or absent production of beta globin chains. So similar to alpha thalassemia, the severity of anemia depends on the number and type of the affected genes. Okay? So we have the imbalance in hemoglobin chains, where when you talk of about alpha thalassemias, when there is an imbalance in the ratio of alpha and beta chains due to missing or reduced alpha globin chains, excessive beta globin chains aggravate and damage red blood cells, leading to their premature destruction. This process is called infective erythropoiesis and contributes to anemia. For beta thalassemia, we're saying that in beta thalassemia, the absence or reduced production of beta chains lead to excess alpha globin chains. So when they are excess alpha chain, from this one, they form a toxic aggregate in the red blood cells, causing hemolysis, destruction of red blood cells, and further contributing to anemia. So we have the shortened red blood cell lifespan, where we have abnormal hemoglobin. So the abnormal hemoglobin produced in thalassemia results in fragile red blood cells that have shortened lifespan. Okay, so normal red blood cells live for about 120 days, but for thalassemia, find that but for the thalassemia, the lifespan significantly reduces due to increased hemolysis. We could also have increased erythropoiesis, where we have bone marrow hyperactivity, and symptoms could include fatigue and weak pulp and enlarged spleen and liver. So those are the different types of anemia that can be discussed here. Remember, we have been able to describe them into microcytic, macrocytic, and normocytic. Okay, so the normal range for MCV that is used to classify is between 80 to 100 femtoliters. Thank you so much, and access the free quiz just to challenge yourself, reinforce your knowledge, okay, so that you can become a better practitioner. Thank you so much.